Hello and welcome to our LinkedIn Live, AI Meets Care inside Great Ormond Street. My name's Natasha Bradley, Director of Empower M365, and I'm so happy to be joined by Mark and Anthony from Great Ormond Street. Mark, can you go first and introduce yourself, please?
Yeah, thanks, Natasha. I'm Mark Coker. I'm the Chief Digital Information Officer at Great Ormond Street, and I've been here since very early 2021.
Perfect, thank you. Anthony?
Hi there, Natasha. I'm Anthony Harper. I'm the Deputy CDIO for Systems and Governance here at Great Ormond Street. I joined shortly after Mark, so must have been around about March 2021 now.
Perfect. Thank you very much. So I think it's probably best to start our conversation with your AI strategy, which I know has gone public. So, from a Great Ormond Street perspective and long-term vision for integrating AI into healthcare, Mark, how does that align with your mission to deliver world-class care?
Yeah, thanks. At Gosh, we've already sort of embarked upon our journey to integrate AI into paediatric healthcare. So it's been quite a journey this year. Obviously, we've released the AI strategy, but at the same time, what we've also done is we've worked on a pilot and wider rollout of both Tortoise for our ambient voice technology that supports clinic consultations, and also the adoption of Microsoft Copilot to help us enhance administrative efficiency. Both Copilot and Tortoise have been shown that they have the potential to be real game changers here at GOSH. In terms of our long-term vision, that's something that is really clear through the strategy and through our actions as well. AI is going to be harnessed to deliver practical solutions that improve patient outcomes and, importantly, streamline our corporate functions and make working life better for all of our staff, but importantly in a safe and sustainable way. We're really clear in terms of the work that we've done this year with the strategy and some of these implementations that AI is here to support primarily, not to replace our clinicians and our staff. So keeping humans in the loop is going to be a real key thing for us, and it's something that you'll frequently see mentioned here at GOSH in terms of the work we're doing around AI. Technology should enable more personalised and efficient and effective care for children and young people, and it should allow us to free up time for our staff to focus on that, which is the most important thing, which is direct patient care. So as we work to embed AI across clinical and operational areas at GOSH, we will ensure that there's always a focus on measurable improvements and to patient safety and efficiency. Every initiative that we are working on will be underpinned by strong governance, transparency, and ethical oversight. So it's actually a core principle that we will not compromise on.
Thank you. And you mentioned a few times safety, and that's obviously a big conversation across multiple trusts. So Anthony, if I bring you in here at this stage, how do you plan to, deploy AI technologies in a safe and ethical way?
So as Mark alluded to, it's one of the core principles of the AI strategy that we put out there, and looking at things from kind of fairness and non-discrimination, and making sure that any AI models that we do actually use don't perpetuate any kind of bias, and we've got an understanding of the diversity of the data sets, and we're able to apply bias detection utilizing the tools that we've got, and also when we're working with partners in the future. So that will touch on also kind of AI decision making, and it's very much around the kind of human in the loop that everyone's talking about around Copilot. The human must be still there and have an understanding of what the AI is actually doing. And there has to be clear documentation around that as well. So where you've got the accountability and you're able to define the AI systems and maintain audit trails of the decisions that are making, and also the way in which those models are being updated, that's kind of fundamental to us having an understanding and be able to kind of manage the governance around that. Then obviously from a kind of governance perspective, you've got GDPR regulations, anonymization, and the encryption side of things that we need to look at when actually handling the data, because obviously from our perspective, we're dealing with clinical data, patient data, some special category data as well. So we need to make sure that safety and security is at the core of that. So working with our clinicians as well, we'll have to look at kind of risk assessments before deploying. So we're looking at having the AI board looking at ethical impact assessments as well. And also when working with partners, look at the threat modeling, because we've been working with our cybersecurity colleagues in order to understand what we'll need to look for. So it's those pieces, continuous monitoring as we move forward to understand any security vulnerabilities that are identified, and then having a robust governance framework, which is part of the work that Mark's been doing around kind of bringing a board together to look at those things. And if there are any issues, because this is new to everyone, I know people are saying they're AI, well, some people may say they're AI experts, but end to end, I wouldn't say there are AI experts at the moment.
Right.
We are on a journey together.
Yeah.
So people may be kind of really good at look at the kind of large language models and building them out, but when you look at deploying them, how that affects patients, how that kind of goes end to end, I don't think there are experts in the field at the moment. So it's something that obviously we're working towards, and we want to obviously help others as we kind of go on that journey ourselves. And we'll be aligning ourselves with the EU AI Act and also ISO 42001 for AI management systems as well as we go forward, as well as the NIST frameworks.
Perfect. I couldn't agree more with you that there is, if anyone says they're an AI expert, be wary, because there is no experts at this point in time. We are all on a long sort of journey. So Mark, within the strategy, there's three sort of key milestones from a GOSH perspective. You know, how are you going to measure success? How are you going to measure strategy across those three milestones?
Yeah, so yeah, you're right. Within the strategy, in terms of the delivery part of the strategy, or we've broken that down into three phases, and the phases are, first one's around the establishing the foundations, and I think that's going to be quite key. Second phase is around expanding and optimizing, and the third phase is around full integration and the leadership around the AI integration at GOSH. In terms of the first phase of the strategy, what we've been looking at is essentially making sure that we've got the fundamentals and the basics right in place. And that's particularly around things like defining governance structures, readiness assessments, and piloting AI solutions. So pretty much a lot of the journey that we've been on this year has been the phase one part of the strategy. We've done quite a lot of engagement with stakeholders, not just as part of the development of the strategy, but also in terms of the work we've done to start piloting some of these technologies and slowly start moving out of pilot phase into the deployment phase of these technologies. And that's been quite key, because one of the other things that we've understood as part of this process is that part of our foundations are not just around the technical foundations that are there in terms of our infrastructure, our network, our security, but they're also around digital literacy as well, which is going to be a massive thing. And it's a key thing to focus on in terms of making sure that people are not left behind by this. So as we sort of touched upon earlier, both Anthony and I, we've been saying that we've piloted Microsoft Copilot, Copilot Chat, and we've piloted Tortoise, which is our ambient voice technology tool. We've developed some policies for governing the use of Copilot and AI, alongside a full review of our wider digital governance. How do we oversee digital at GOSH is something that we're currently going through a review at the moment. And I think once we get to the other side of that, it will really set us up quite nicely for the second phase, which is to expand and optimize, which is essentially around scaling the tools that we do have. And what we effectively will do here is build upon some of these robust platforms that we've put in place. Looking back to Copilot is a good example, because we've started to understand the capabilities of, say, let's stick with Copilot and know what it can do. And phase two will be all about expanding on what we've done with Copilot and moving it into taking it forward, taking it to the next level. And part of that will be the introduction of agentic AI and the adoption of AI agents to further enhance our administrative efficiency at Gosh. Looking at some of the things that other sectors have done using Copilot agents and some of our own research and our enhanced understanding from the pilot that we've run this year, we can see that there's going to be so much scope here to actually transform the way that we do things at Gosh. Alongside all of this, we'll be developing and making sure that we've got the correct monitoring systems in place. And I think there's going to be some work that we'll do to strengthen some of our external partnerships to help us further drive research and innovation around AI. Finally, around the third phase, in terms of that deeper integration, our ambition is the full, fully integrated, or rather the full integration of advanced AI capabilities, including precision medicine and robotic assistance for surgery at Gosh. We want to be leaders, and we want to be leaders in the field of AI within the NHS, and that's not just within Gosh, but we want to be able to take that out into the wider NHS, and and I think there's lots that we already have started to do in that space, and we can see more potential for continuing that. Success has got to be measured through some clear metrics and KPIs. Improvement in patient outcomes, operational efficiency, staff experience. They're going to be key to seeing the effectiveness of this work, and we're going to need to continually, regularly review this process, and that's what we've actually been doing. So Copilot's a good example there, and I'll probably we'll talk a little bit more about the kinds of things we've done to ensure that we're getting the best value from our investment in Copilot.
Thanks, Mark. And, I know that you at Gosh understand the importance of adoption. So, Anthony, how are you preparing your workforce for AI integration, Copilot deployment? What training initiatives have been introduced, etc.?
Well, that's firstly, that's a large piece of work, but yeah, it is definitely something that we've taken into account. So we've been looking at general workforce training. Mark touched on that, kind of looking at digital literacy, but we'll also be looking at data literacy as well, because we need to kind of take our employees on a journey about how to interpret and validate data that's coming out responsibly. Because as I said about human in the loop before, it's still an important factor when you start to utilize AI and explain its benefits and limitations. So people need to have an understanding about what comes out of the AI, and also how they're validating it, and that it still needs to be reviewed to make sure that the content's correct. But we've also been looking to build that awareness across all levels. So we've done some role-specific upskilling and tailored training. So we've started to look at that profiling in relation to what skill sets will require what AI. So as Mark's alluded to, around the utilization of Tortoise from kind of ambient voice technology for clinicians, and then we're looking at how we can kind of really utilize our M365 Copilot when looking at data and all of the output that we're getting from some of our kind of BI and performance teams. So we're looking at that role specific upskilling as well to help facilitate our uptake, and it comes from the top. So we've had some executive education sessions as well, and it's important that obviously that's driven from the top, but also the whole organization understands where the benefits can come from. So I'll be working with nursing teams, working with allied health professionals, trying to get an understanding of use cases, and working with partners as well in order to help facilitate that adoption. So we'll be looking through that and encouraging people to have that critical thinking, to question the output and recognize if there is any bias, where it's coming from. Yeah. So it's important for us to look at that piece. And as we've said before, the kind of transparency is all key here, that we've got an understanding of how those AI models are working, what the output is, and people are willing to question the output on the other side. So that's the journey that we're taking our staff on. And it's something that we'll need to train and work with partners in order to facilitate, because it's, as I said at the outset, it's a lot of work.
A lot of work, and it's a journey, isn't it?
Indeed.
It's a journey that we're on. So we've mentioned Copilot a few times, but I don't think we've touched upon what your vision and strategy specifically for Copilot. So Mark, can you just give us a little bit of information about what your vision is for Copilot across the trust?
Yeah, no, thanks. So our vision, I think, is really clear. I mean, we see Copilot as an advanced AI assistant. Obviously, that's designed to enhance productivity and collaboration in the trust. So we want to use Copilot to simplify administrative workflows and tasks and automate routine tasks as well. So basically support our staff in managing documents, emails, meetings. But as I've touched upon a little earlier, what's also quite important is to see we see as part of our vision for Copilot the use of advanced agents to further enhance those administrative efficiencies. The game is clear here in terms of where we see this going. We want to reduce this burden, this administrative burden, so that our teams can focus on what's key and fundamental for them, which is the higher value work, which is patient care. We feel that we're taking a measured approach. Governance is key. It's critical. We need to do this safely, and we'll, as both I've said and Anthony said, having that human in the loop is going to be quite key. It's going to be important that when people use this technology, when people use Copilot, they must check their outputs. That is a really key fundamental thing that we highlight in training. We highlight at every opportunity for people. And I think if we can get these basic fundamentals right, we can ensure that Copilot will be used safely. And importantly, as we've both emphasised, it's got to be used transparently and in line with our governance frameworks.
Yeah.
So we've put into place as part of the work we've done this year with Copilot is that every staff member using Copilot must undertake mandatory training, and its uses. We monitor very closely the use of the Copilot to ensure compliance with data protection and information security standards. But I suppose like many other organisations, we're now moving away from asking what can Copilot do for us, because I think that's part of our phase one. What can we use Copilot to do for us, and how can we transform our ways of working? But I think what we now need to do is to start looking at how we further embed AI technology, Copilot, within our workflows, within the organisation, and how we take our staff with us on a journey. I think there isn't just a technical and digital change here, or a digital literacy change that we need to focus on. We need to focus on the cultural aspects of it as well, because we are fundamentally changing the way people work and how they approach their jobs. I mean, when most people come into the office, the first thing they do is they probably switch on turn on Microsoft Outlook. They log into Teams. I think that the third thing they should log into is Copilot. Yeah. That's the third application that they log into, and that's part of the cultural change that we need to see happening.
Yeah, no, great. And Mark, have you seen any strategic benefits within your sort of pilot of Copilot?
Yeah, I mean, we've seen lots of benefits from using Copilot, and I think just looking at the wider NHS and other public sector organisations, I think some of the benefits of Copilot are really already clear and evident. That by automating some of these routine tasks that we've been talking about, it is freeing up staff time, reducing errors and improving efficiency. So some of the early pilots that we've been tracking as part of the work we've been doing have shown efficiency savings of up to 10 to 20% in administrative areas, and our early work is seeing similar results.
Fabulous. Yeah.
We are measuring the impact through a number of operational metrics, such as reduction in task completion time, improvements in staff satisfaction, and the ability to redeploy staff into more meaningful work. What's been really important in doing this and measuring this is two things that we've done. Firstly, we've used Viva Insights as part of our deployment. And the second thing that we've done is deploy surveys out to staff that are using Copilot to understand how they're using it, what they think and where they're saving time. Viva Insights has been actually quite invaluable to us in terms of monitoring the effectiveness. It gives us a really clear view of where it's being used, how it's being used, and also importantly, where usage is low. So this insight has allowed us to say, well, we've allocated so many licenses to Copilot users. We notice you're not using it very much or quite infrequently for some users. That gives us the opportunity for us to move them onto a Copilot chat license, which is a free of charge license, gives them a lot of the same functionality, but it's more geared towards users that are infrequent. Mm-hmm. But at the same time, what the stats also show is who are the really heavy users of Copilot chats, because as we reallocate licenses, we've got a ready-made list of people that we can move on to a full Copilot license, and that's been really helpful. And that approach has really helped us with making sure that we've made the most of our paid for licenses and kept our utilization rate up. One of the key challenges, I think, and I can't claim that we've solved it here just yet, is finding effective ways to make sure that we, one, track the benefits of Copilot, but also see that where we are making these efficiency savings, how we're channeling that time back into effective use of people being able to do other things. So I think it will be a challenge for us to move that beyond the sort of anecdotal into, well, as a result of doing this, we've now been able to release this or this time, and we've now been able to do 10 more of these things or 5 more of these things. That's going to be an important thing. And we continue to track the benefits and monitor the KPIs and talk with our teams and our stakeholders to make sure that we are doing this right and we do get this right.
Perfect, thank you. Anthony, in your opinion, what do you feel that the top 3 successes would be from the pilot so far?
Top 3.
If you've got more than 3, you can share 3.
Because I've sat in on some of the workshops with the teams, and I've sat down with partners and Microsoft going through this. So top 3, one of them I'd probably say, if you're looking at kind of releasing those benefits that Mark was alluding to, I would say if we looked at things like policy drafting, things that are really time consuming, and you need to kind of use a wealth of kind of documents and reference points, and people are able to pull together something, at least utilizing the various kind of documents and guidance to facilitate pulling together something that they can then start to work on and really kind of plug into. And that takes away a lot of the initial legwork. So we've seen people come back with a lot of the feedback from the surveys talking about policy drafting as one of the kind of main points of the kind of benefits from a time perspective. The other piece would be around the feedback from transcription. So the whole transcription, utilizing Copilot to then format those minutes, pull them together, process them, ready for someone that would normally be in the meeting kind of taking the minutes or waiting for a recording and then going back through the recording to do the minutes. It takes all of that time away, and essentially you're able to run it through Copilot, and then you've got a set of minutes that they can be then reviewed by the person who would normally do the minutes, and then they're able to utilize that time elsewhere. And this is the piece where Mark was alluding to about how do we measure what that time really looks like moving forwards. The other piece I would say is we've had some really good use cases from a governance perspective. And when you start to look at pulling together the data that you need for some of those reports and utilizing Excel, now it does require, as I said, we were kind of looking at earlier in relation to training for specific areas, but whereby you've got people that are kind of champions for Copilot and they're going out of their way to see how it can be utilized best. We've found some really good use cases with Excel, and that's been a struggle in some areas. So I struggled personally kind of utilizing Copilot with Excel due to data quality, because you need to work on that a bit. But when you have got that data quality there, it completely revolutionized the way in which the department was able to work. And then we're now looking at ways in which we can roll that out further within those data areas. So yeah, I'd probably say those are the three best examples that we've got of kind of saving time, enhancing productivity, giving people time back.
Perfect. I'm going to put you on the spot now, Anthony. Can
Okay.
you provide your top 3 tips to trusts who haven't yet started their journey?
Okay.
While you're thinking, I've got one actually.
Go on, Mark.
While you're thinking, I think it's important to make sure that you've got the governance right at the beginning there. So one of the first things we did is make sure that we had a policy for the safe and acceptable use of Copilot, and we did that before we got our AI policy ready. One, for speed, because we knew it would have taken longer to get a wider AI policy in place. But having that policy in place, there's a really nice summary page in that policy, which is a list of do's and don'ts in terms of the use of Copilot. And I think that was a really good way of actually setting the scene and saying, yes, we want you to use Copilot. Yes, we want you to improve things and to be more efficient. However, we don't want you to do these things, but these are fine. Sorry, Anthony. I just that's when I'm asked that question. That's the one thing I always come back to.
You did me a favor there, Mark. You gave me a moment to think. So yeah, I'm good. I'm good to go now. So from that perspective, I would say the top things are monitoring of use, because when we're doing the pilot, it was important that we kept on going back to what does the utilization look like, because the breakdowns that you can get from Viva and the Copilot dashboards give you all of the insights that you need from that perspective. We could then look to reallocate licenses, look at people that have shown an interest and had actually requested for a full license, reallocate it to those individuals, and then we were able to kind of make informed decisions around, right, where are we doing these? Okay, how do we then run our workshops? Who are we targeting for workshops? So a lot of that comes from the data monitoring, which the team's been fantastic on, and we've kind of pulled in different areas of expertise to do. So that would be kind of one imperative thing that I would suggest to anyone, that you've got people looking at that, actively looking to redistribute licenses, working with your stakeholders within the wider organization, clinical teams, operational teams, to make sure that you've got that kind of split. So you've got an understanding of what the use cases are in different areas. And then when you look to expand on your utilization of Copilot, you know where that breakdown is in skill sets and what you're looking to utilize Copilot for in those areas. So that comes from the monitoring aspect. That's one thing. The other aspect I would say is, and it's something that we didn't particularly do well, and I think as we move forward, we'll have to embrace it a bit more, and it's the use of champions. So we set up a champions network. We set up a team, champions network, announcements. That's how we did the surveys, those kind of things to get that engagement. But that didn't quite land as we expected. But what we found is, out of the natural kind of utilization of the product, you get those champions coming forward naturally, those people that are really engaged, those people from different areas that you may not have identified initially, but as you've gone through the pilot, we've then identified people that really are drivers within their area for technology, not necessarily the general manager of an area or a service manager. So you start to identify those people that can really kind of work within those areas and units to try and embed the technology. So that has been helpful as we've worked forward. But initially, I don't quite think we got the right champions, but that has really come out as something that was beneficial. And the final thing I would say is, when you're doing the pilot, is categorizing and defining those use cases, because realistically, if you're going to make any investment, then you need to be able to identify how the organization is going to be utilizing the product, where those benefits are going to be made, whether they're going to be kind of tangible or intangible. Mark was alluding to like a 20% saving in admin time. And then we're also looking at how it can obviously facilitate, not necessarily Copilot in this instance, but from the tortoise perspective, how it can bring back clinical time as well. So you're trying to understand how that's being done and how you can redistribute that, whether that's by financial savings, running more clinics, getting more throughput from minute taking. All of those kind of things can then be assessed based on those defined use cases that you've got in that initial business case from your pilot being run. So they're probably the three things that I'd say would be most beneficial for trust to focus on.
Perfect. Well, Anthony, Mark, thank you very much for joining me today. It's been
Thank
great
you.
to have you. Thanks everyone for listening, and we'll see you soon. Thanks everyone. Take care. Bye-bye.